Good afternoon. Before I begin with an update on Alberta's response to COVID-19, I'd like to just pause to pay tribute to two Albertans who've made very significant contributions to our province and who we've lost this week. First of all, this morning I received the sad news that the Honourable Senator Elaine McCoy passed away in Ottawa this morning. Senator McCoy, of course, had served in Alberta's legislature as a minister of multiple portfolios in the Getty government, and in the past 15 years represented Alberta in the upper chamber of Canada's Parliament. I was very honoured to work with her in the past 18 months in the defence of Alberta's vital economic interests, and we are very grateful for her strong advocacy for this province, and our condolences go out to all of those who mourn her loss. Similarly, I need to pay tribute to a truly great Albertan, Mrs. Jean Lougheed, who passed away this week at 92 years of age, who was the most important partner and advisor to one of Canada's greatest modern premiers, the late Peter Lougheed. Jean was by his side not only as his best friend, but his closest advisor over all of those years, and contributed enormously to the vitality of our province, including as a great champion of arts and culture, of the creative industries, and so many other worthy causes, and she will be deeply missed. Our condolences go out to the Lougheed family and all of those who mourn the loss of Jean Lougheed. The flags fly at half-mast here at McDougall Centre in Calgary and at Alberta's legislature in Edmonton in honour of both of these phenomenal Alberta women. Today, there are 14,785 active cases of COVID-19 in Alberta. That number continues to decline as we've had 1,548 recoveries, but 879 new positive tests. That is on just over 11,000 tests for a positivity rate of 7.7%. 890 Albertans are in hospital with COVID-19, of whom 153 are in intensive care. Sadly, 26 more Albertans have passed away, meaning that 1,028 Albertans have lost their lives to the COVID-19 pandemic since it began in the spring. Earlier this month, let me pause to say I'm sorry again that, as I did in my statement yesterday, our condolences go out to all of the families of those whose lives have been lost to the pandemic. Earlier this month, it was my pleasure to announce the arrival of 25,350 doses of the Pfizer vaccine to Alberta. And today I have more good news to share, now that the Moderna vaccine has received Health Canada approval. Today, 16,900 doses of Moderna vaccine will arrive in Alberta and will immediately begin immunizing residents at long-term care and designated supportive living facilities. The first shipment will arrive at facilities in Edmonton, Calgary, Red Deer, Medicine Hat, Lethbridge, Grand Prairie, St. Paul, and Fort Saskatchewan. This is exciting news for staff, residents, and families of these facilities who have been on the front lines of our battle with COVID-19 since the spring and who have experienced untold pain and loss. And Minister Shandro will expand on our efforts to protect long-term care residents in just a few minutes. Because the Moderna vaccine can be stored at relatively moderate temperatures, it can more easily be transported to these facilities, making it the ideal vaccine to reach our most vulnerable populations. This is in comparison to the Pfizer vaccine that requires ultra-cold temperatures at about -80 degrees Celsius, which makes transporting that vaccine to any off-site location very challenging. This news is particularly welcome as we look towards a new year and what we hope will be a turning point in the fight against this pandemic. While this is encouraging, it is not the end of our hard work. We must continue to follow the health guidelines, of course, and to do everything we can to keep each other safe. While we wait for the vaccine to be able to be available for broader immunization. As more shipments of both the Pfizer and Moderna vaccines arrive in early January, immunization will focus on residents of long-term care and designated supported living facilities, followed by seniors aged 75 and over, and First Nations on reserve, Inuit and on-settlement Métis individuals aged 65 and over. Immunization of respiratory therapists, intensive care physicians and staff, and long-term care and designated supportive living facility workers across Alberta will continue. In fact, by the end of today, Alberta Health Services will have administered over 7,000 doses of vaccines to frontline healthcare workers. I know Albertans are keen to hear more about when the vaccine will be available more broadly, and I want to assure you that we also want to provide you with that certainty as well. But I must ask for patience as we await the first regular shipments of both Pfizer and Moderna vaccines. We are still on track with the phased approach that I outlined earlier in the month. Over the coming weeks, we'll see vaccines continue to be offered to respiratory therapists, to healthcare workers and in intensive care units, to staff in long-term care and designated supportive living facilities, and we'll be expanding our efforts to get vaccine into the hands of healthcare workers in emergency departments. And most importantly, we'll be reaching residents of LTC, that's long-term care, and designated supportive living, regardless of their age. Later this winter, by February, we anticipate rolling the vaccine out to seniors who are 75 years of age and over, no matter where they live, First Nations on reserve and Métis persons on settlements who are 65 or older, and that is because that population is experiencing, unfortunately, significantly worse health outcomes from this virus, and healthcare workers in medical, surgical, and COVID-19 units or operating rooms. As more vaccines arrive, we'll ensure that Albertans who wish to be vaccinated or immunized as quickly as possible when they are eligible can do so. Everyone who wants to receive the COVID-19 vaccine will be able to do so when their turn arrives. Now, before I hand things over to Minister Shandro, I'll stress again the importance of maintaining our vigilance. The arrival of the vaccine does not mean that the pandemic is over. And while we have seen progress as the number of active cases has come down by nearly a third over the past 3 weeks, there is still so much more to do, as we can see with 890 Albertans in hospital as a result of COVID-19. So with that, thank you very much, and I'll hand it over to the Minister of Health to provide more information on the vaccine program, as well as Alberta's efforts with respect to residents of our long-term care facilities.
Well, thank you, Premier, and good afternoon. And along with Premier, I just want to start by, extending my condolences as well to the families of both Senator McCoy and Mrs. Lougheed. As Premier said, I want to give you an update on Alberta's continuing care system and the work that is underway to support our operators, their staff, and the residents of these long-term care and designated supportive living facilities. Now, this past year has been one of the greatest challenges that we've faced as a province. And as you know, it's been especially hard on the people who live in our continuing care facilities and their loved ones as well, and the people who care for them, those staff members and the operators as well. I'm going to talk about numbers and policy issues, but what we're really talking about is our patients and grandparents, including my own. This is deeply personal for Albertans, as it is for me. My parents and my in-laws are in their 70s. We're talking about them, and I know the same is true, or something like it, for everyone that's listening. Now, our continuing care facilities are home to about 28,000 Albertans. These are the people who are at highest risk from advanced age and medical conditions, as well as the nature of the care that they need and that they receive in these facilities. The reality is it involves close contact with teams of caregivers, and that poses risk. The data shows overwhelmingly that the risk of severe illness from COVID increases with age. But the nature of continuing care means that people in these facilities are at much higher risk than seniors who are living independently or in other settings like lodges and seniors' apartments. So we've worked with AHS and continuing care operators throughout to support them in working to keep these residents safe. Now, COVID comes into continuing care from the community. So as cases have increased in the community, we've seen increases, unfortunately, in continuing care as well. And as you can see, we've had a rapid increase in our community cases since early October. And in response, we brought in new public health measures in November with more restrictions added again on December 8th. Now, the same growth in cases is mirrored in Alberta's continuing care facilities with increased outbreaks and case counts across the system. Now, there's no question that the behavior of all Albertans is intertwined with keeping our family and our loved ones who live in continuing care safe. We can take precautions within a facility, but nothing is a substitute for managing COVID spread in the community. Now, Alberta is not alone in its challenges with COVID and continuing care. As of December 18th, about 65% of reported deaths in Alberta have been residents of long-term care facilities or supportive living. Now, Ontario is similar, with about 62% of reported deaths being residents of long-term care, and BC has seen about 73% of deaths occur among facility residents. Now, none of that is to diminish the deaths of more than 1,000 Albertans due to COVID. Every one of those deaths is a tragedy and an irreplaceable loss to their loved ones and to the community. Our commitment as a government is to support our continuing care operators in any way that we can. We've committed $260 million to contracted operators, in addition to more than $500 million flowed to AHS for its own operations, including continuing care. From the very beginning of this pandemic, Alberta's COVID response has focused on protecting residents in these facilities. We made adjustments as new evidence emerged, and we listened to residents and their families while balancing the need for strict public health measures. The single site policy, the visitation restrictions, the aggressive COVID testing and training and proper use of PPE are just some of the examples of measures that have been taken to date. Beginning in March, we relied on the Chief Medical Officer of Health, Dr. Hinshaw, and her orders to quickly communicate up-to-date expectations for operators, for their staff, and for the families of the residents. The standards within the Chief MOH orders have been updated over the course of the pandemic with a total of 10 orders over time, 2 of which are currently in place. Application of the orders is intentionally broad so that they apply to more than just publicly funded healthcare sites. The scope of all orders includes all licensed supportive living, such as lodges, group homes, and private pay supportive living, as well as hospices as well. Not only did we apply key orders such as single site and visitor tracking, we implemented tools to ensure these were adhered to. For example, we purchased web tools to track both single workers and to track visitor self-reported health status. As the pandemic proceeds, our standards and the measures are refined as we learn more about the virus and we learn more of its total effects. For example, to balance physical safety with mental health and quality of life, we allowed residents to name a designated family support person that would be allowed to visit during the pandemic. We also coordinated telephone town halls so that operators, family members, and some residents could keep in touch during difficult times, several of which Dr. Hinshaw attended and participated in. All of these measures haven't been easy for residents, for staff who support them, or for the families and the loved ones of the residents. There have been long periods of time where visitation was restricted. And I want to thank the staff at these facilities and the friends and the families of the residents who have sacrificed precious time and connection with their loved ones. I also want to thank the residents for their resilience and their personal sacrifice. This year has been difficult for everyone, but being unable to see loved ones has been especially hard on residents in continuing care. The actions that we've taken and the orders put in place are supported by strict operational standards at all facilities. And these operational standards are the frontline, immediate steps that help limit the spread of COVID-19 and help contain outbreaks. Key components of COVID-19 specific operational standards include symptom screening, where staff are screened at the start of every shift. Residents are screened at least once daily, and designated family or support persons and other visitors are screened upon every entry into the building. Single-site staffing rules ensure that long-term care and designated supportive living staff are limited to working within one facility. And it's been a huge challenge to staff shortages caused by the pandemic itself, but 90% of our facilities are in fact achieving single-site staffing. The remaining 10% have received exemptions specific to close monitoring and extra infection control measures. Admissions to a facility are restricted when a facility is under investigation or has a confirmed outbreak. Anyone working in a resident care area must continually mask throughout the site at all times. And anyone who is unable to maintain physical distancing must wear a mask continuously. And where there is evidence of continued transmission, 2 or more confirmed cases, then continuous eye protection must be worn in addition to continuous masking. And finally, enhanced cleaning and disinfecting rules include cleaning all high-touch surfaces at least 3 times daily and low-touch surfaces at least daily. And I want to thank the continuing care operators. I want to thank their staff for their extraordinary work to maintain and exceed these operational standards. Now, along with operational standards, we've introduced other measures to help support the staff and the residents at our continuing care facilities. Earlier in the spring, we gave operators additional funding to help offset the costs of extra cleaning and extra staffing. And we've offered wage top-ups for healthcare aides, those individuals who play a critical role and provide key supports for residents in our facilities. We expanded the scope of practice for nurse practitioners so that their expertise can be better leveraged in the continuing care system. And we've introduced more paid student practicums to get more skilled workers into facilities to help reduce the workforce burden. Now, moving forward, we have a few areas of focus to enhance our response to outbreaks and bolster our support for the system. We remain committed to getting into a facility quickly if cases are identified, and implementing rapid testing is a huge boost. The ability to get results within minutes is an incredible feat of science. As more mobile units are activated around the province, we'll see an even greater ability to contain outbreaks. We're also working to expand our workforce through the addition of about 3,000 comfort care aides, and we're undertaking student recruitment for the continuing care workforce. We'll be continuing our work on a facility-based review as well, something we announced earlier before the pandemic began in 2019. Now, although this work is underway prior to the pandemic, as I said, we'll now incorporate the learnings from the last 10 months that review of our facility-based care system. Learnings and recommendations will be applied to new legislation, changes in the way we fund development of new buildings and refurbish existing ones, like shifting focus to more private rooms and upgrading our HVAC system in our facilities, improvements in the use of technology, and changes to staffing. Now, this review will also help our province be better prepared to deal with future pandemics and outbreaks of influenza, for example. And finally, we're thrilled about the arrival of both the Pfizer and now, as Premier said, the Moderna vaccine. Since the arrival of the first Pfizer shipment on December 14th, and then the second shipments on December 22nd, we've seen about, well, actually, I just heard from Dr. McDougall, the senior MOH of AHS, just before she left her office earlier today, that almost 7,000 healthcare workers now have had their first shots. And this actually also does include staff in our long-term care facilities. As Premier spoke about in his remarks earlier, we are now in a position to be able to immunize residents in their facilities. Now, this is a huge step forward in our efforts to protect these residents, to protect the staff, to protect the families of these residents. Having the ability to bring the Moderna vaccine to the bedside will make a massive difference in our ability to stop the spread. It also means that we can reach more remote communities where the impact of a COVID outbreak can be devastating. And it means that we can work to protect entire facilities at once, immunizing entire floors and facilities in one visit. Immunization is also quickly moving out to other congregate care settings and into the broader community of seniors, as Premier mentioned. Our first focus is on the most vulnerable, where we have seen the greatest impact throughout the pandemic. But we will rapidly move beyond that in the coming weeks as more vaccine arrives in the province. We set an aggressive target for the end of this year based on the supply that was expected at the time. The exact dates, the exact amounts of the vaccine we're receiving have shifted a bit in these first few weeks, as was only to be expected, but our commitment remains that we're getting the vaccine out to staff and to residents as fast as we receive it, given the complexity of handling the Pfizer vaccine in particular, the requirements for staff training, etc. AHS will be ramping up as shipments come in, and at the same time, we're seeing a sustained drop in new daily cases, with the result that active cases are now below 15,000. They peaked at just over 21,000 just a couple of weeks ago, so this is a real improvement. I know for some people it will raise the question, why are the numbers of people still dying still so high and even going up when cases are going down? So it's important to be clear. Deaths do typically lag new cases by a couple of weeks, so this is no contradiction. We are at a turning point in the pandemic where the decrease in new daily cases will soon lead to a decline in mortality and an easing of the burden on our hospitals, but only if we stick with it, especially through the New Year's holiday. So I want Albertans to be encouraged. We've slowed the pandemic and started to slowly roll it back because Albertans have done the right thing. Now we need Albertans to continue to keep doing it and to allow time for the vaccines to finish the job and finally put the pandemic behind us. I want to finish with a reminder that the lives that we've lost and condolences to the families of those who have passed away. But I also want to look forward to 2021 with hope and with thanks to everyone who has helped get us through this year, especially to all those who are working in our hospitals and our continuing care facilities. I know you'll be working on New Year's Day like you did on Christmas Day, and so again, thank you. And here's to a better 2021 for you, for your patients, for your residents if you are working in continuing care, and for all of us throughout the province. Thank you.
Before we get started with the Q&A, I'd like to ask those on the line to be brief and limit themselves to one question. Operator, can you please put through the first caller?
question is from Emma Graney with the Globe and Mail. Go ahead, Emma.
Yeah, g'day. This is probably for Minister Shandro, but Premier, if you want to jump in, if you have anything to add, that's cool too. Just curious, when it comes to vaccines, how challenging is it going to be to ensure that there is actually enough staff available to administer vaccines? And what's the province's plan to kind of deal with that? And just further to that question, what's the risk that those staffing needs are going to require shifting resources from other areas of the healthcare system?
Thank you, Emma. It's a fantastic question. So we began to consider this actually in the summer, knowing that the vaccine was eventually going to come, that was going to come in phases. So for phases 1 and 2, we are going to be relying mostly on AHS, if not entirely on AHS, to be administering the vaccine and providing it to community seniors, to their staff at AHS, to the staff and residents in continuing care. Is going to be mostly through the public health nurses. I can't remember off the top of my head the exact number of doses that our many public health nurses throughout AHS can administer on a daily basis. I might have to defer that to Dr. McDougall, who's here with us today, the senior MOH with AHS. But it's an extraordinary amount. It is enough, and I think for phases 1 and 2, we do have the workforce capacity with our public health nurses to be able to, as we receive vaccines, be able to get it out the door for phases 1 and 2 in using those public health nurses. So, but then as we get to the community rollout in phase 3, we are going to be looking at how we do roll out the influenza, seasonal influenza vaccine, and relying on community partners like our pharmacists. But Dr. McDougall, if I could impose on you to maybe just clarify the number of public health nurses we have and how many they can administer in a day.
Thank you very much. So our plan on the human resource side for the vaccine is actually to draw upon a whole workforce who is capable and who deliver vaccine during our seasonal flu campaigns and into our long-term care facilities every year. That includes our public health nurses, as mentioned, as well as our whole team of immunizers who help make sure that all acute care staff have the access to immunization in every hospital all the way across the province. We're also bringing in retired nurses as well as student nurses to help with the extra work as we're going forward. And as the plans and the number of doses coming in becomes more clear, we'll make sure that we're titrating the number of staff available to do this work with the number of doses coming in. Within our long-term care facilities, again, they're partners in delivering vaccine every year, and we'll be drawing on their expertise and resources we're going forward as well.
So you're getting the full meal here, Emma. I just wanted to add something about vaccines to say that our COVID Cabinet Committee met this morning to review in part the rollout of the vaccination program. And until now, my understanding is that AHS had been holding back half of the doses in our possession in order to set them aside for the administration of the second dose in these double dose protocols. Some other provinces had proceeded, however, to depend on future shipments, and our Cabinet Committee directed AHS to proceed in that direction, which is to say to use as many of the vaccines as we can right now. And Pfizer has also given us a little more flexibility in terms of where the vaccines can be administered. So we should be increasing the pace of vaccination as a result.
Operator, can you please put through the next caller?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi there. This is a question for the Premier and the Minister. You previously said the goal was 29,000 vaccinations by the end of this year, but then you said we're only going to be at 7,000 by the end of today. So is it safe to say we're going to miss the goal?
Yes, and that is primarily because what I just explained, which is AHS had decided to exercise great caution in holding back half of the vaccines that we had. in order to set those aside for the administration of a second dose. But the COVID Cabinet Committee directed AHS to do what some other provinces have been doing and just moving forward with the administration of as many vaccines as possible, counting on the future large shipments that we will be receiving in order to administer the double doses. My understanding is that we are we're scheduled to do about 4,000 additional vaccines in the next couple of days, 2 or 3 days. We've also directed AHS to schedule as many as they can as well on New Year's Day, which had not originally been the plan. And so we hope to start catching up and towards that goal. And Dr. McDougall, would you like to add anything to that? Or Minister Shandro, go ahead.
Thanks, Kevin. And just one other factor that does come into it as well is the previous decision of Pfizer to restrict the administration of the vaccine to where it's delivered. So out of our, priority groups for phase 1, the A priority groups A, most of those folks are the 28,000 of them, as I said earlier, are the residents of long-term care and DSL, as well as 36,000 being the staff of those facilities, and then 11 to 12,000 being home care workers. So a big number was going to be those folks who are not AHS employees. Now, thankfully, Pfizer has changed that decision and allowing AHS to administer the vaccine other than where it's delivered so that they can get it out to those facilities. That came late. That came on December 22nd. So now that change has happened, is going to allow us to get the vaccine out much more quickly here in Alberta. Yeah.
Operator, can you please put through the next caller?
Next is Safe Kaiser with 660 News. Go ahead, Safe.
Thanks. Good afternoon. My question for the Premier. Now, you say the reason the province fell short in vaccinating 29,000 healthcare workers is because Alberta Health held back half of those vaccines, but only 7,000 people were inoculated, so that's only a quarter, not half. So did anything else happen there? And when can those remaining 22,000 healthcare workers that were supposed to be vaccinated by the end of this year expect to be vaccinated?
Well, I'm going to refer that to Dr. McDougall in terms of the schedule for vaccination of those frontline workers. What I can say from the briefing we had this morning at our Cabinet COVID Committee is that we expect the pace to pick up significantly with the administration of first doses without holding back half of our supply, and secondly, the flexibility that Pfizer has now given us to administer their vaccine at multiple sites should also help to accelerate. Doctor, would you like to speak more to that?
Hi, thanks very much. So starting tomorrow, and again with the direction from the Cabinet Committee, the vaccine will be going out to long-term care and designated supportive living facilities in all 5 zones across the province. And again, that will significantly pick up the pace in terms of the rate at which those vaccines will be delivered. We'll also be increasing the number of clinics available for booked appointments for those designated healthcare workers who, again, were put into the first sequenced group. We'll be doing everything we can to get to those numbers of doses that were spoken about earlier, and again, still trying our very hardest to get to that 29,000 mark by the end of this calendar year, and if not, then spilling over into that first week or so of the next year. But it's all hands on deck at this point.
And Safe, just to correct one thing, I think you said 29,000 healthcare workers. It was 29,000 Albertans. So just to correct you there, and remembering that if we look at the priority groups A, in phase 1, it was a total of 85,000 Albertans. But again, 36,000 of them, the staff of our long-term care and designated supported living facilities, 28,000 being the residents, 11 to 12,000 home care workers. The remainder was a small number of healthcare. To some extent, for the phase 1 rollout, was limited until Pfizer made the change in allowing AHS to deliver the vaccine on December 22nd at facilities other than where it was delivered.
Okay, we have time for 3 more questions. Operator, can you please put through the next caller?
Next is Robson Fletcher with CBC. Go ahead, Robson.
Hi there. My question is for the Premier. Premier, it took nearly 9 months for Alberta to record its first 500 deaths from COVID-19, but these next 500 deaths we've seen just over the past 5 weeks here. So given the public health measures you enacted appear to have succeeded in curbing the number of new cases, but as Minister Shandro noted in his remarks just now, these deaths were the result of infections that happened earlier before those measures took effect. My question is, how many of those 500 deaths do you think could have been prevented if those measures had been adopted sooner?
Well, this is the fall wave that we've seen in northern jurisdictions, particularly colder northern jurisdictions across the northern hemisphere. We've seen a significant spike in cases and fatalities. That's often the case. That's always the case for communicable diseases of this nature, that there's a fall surge. So unfortunately that's affected Alberta like so many other places, like here in Canada, most other provinces. And of course in many U.S. states. Having said that, fortunately, our fatality rate here in Alberta is about half of the national fatality rate. It is below, I believe, the fatality rate of all 50 United States, and I believe all but about 5 of the European countries. So, of course, any fatality is a tragedy. At the same time, I think that speaks well to how Albertans have risen to the challenge. The bending down of the curve, which we started to see about 3 weeks ago, was a result of, we believe, measures that were announced in mid-November, and we should now start to see the full effect of the more rigorous measures introduced in mid-December. I am concerned, to be blunt, about what we might see coming out of Christmas, because inevitably there will have been more there will have been at least some degree of socializing here in Alberta that could affect our numbers that we might see pop up in a couple of weeks. And as the Minister Shandro mentioned, that could also happen around New Year's. It's very clear that the fall spike here, based on what Dr. Hinshaw and her team have analyzed, started with Thanksgiving. If you look at where that really started to pick up, it was almost exactly 14 to 20 days after Thanksgiving when family gatherings happened, and then against our advice, people obviously also had Halloween parties. So it was that those intimate family gatherings, social gatherings, together with people indoors with cold weather, that led to this spike. And I just want to say thank you to all of the Albertans who have made sacrifices to abide by these new public health guidelines over the past several weeks. Because of that, we are making progress.
Operator, can you please put through the next caller?
Next is Mia Williams with Reuters. Go ahead, Mia.
Hi. Quebec said today that they are asking the federal government to enact new testing at airports. Is Alberta asking for anything similar?
Could you repeat the question? We don't have a very clear connection, I'm afraid.
Hang on. Is that better? Quebec said the federal government to enact more vacation. Is that something Alberta is asking for too?
Okay, so we have encouraged the federal government to expand the travel pilot program, which we started here in Alberta about 10 weeks ago. We think it's been very successful. It's been helpful because for the people who enroll in it, we were able to pick up those who test positive right away, which helps us to intervene much more quickly. Now, here's the challenge. This is a free country, and you can't strap someone down and shove test up on them that they object to personally. And so we need people to voluntarily participate in the testing program. The way to do that is to incentivize it, as we've done through the travel pilot program. So we would commend that to the federal government to spread that out to other major airports across the country, so that returning international travelers have an incentive to go through the testing program. I do want to commend the airlines. I think that they've been very responsible. We've seen very few, if any, recorded cases of transmission aboard Canadian air carriers, and I think they're practicing the greatest diligence possible. But certainly, we think the basic parameters of the travel pilot to other major airports would be very helpful.
Operator, can you please put through our final question?
Final question is Janice Johnston with CBC. Go ahead, Janice.
Yes, thank you very much. This question is for the Premier. The head of Ontario's vaccine program, Rick Hillier, admitted yesterday that it was a mistake to scale back vaccinations over the holidays. Do you think it was also a mistake for Alberta to suspend vaccinations on Christmas and New Year's Day?
Well, in fact, we directed AHS to use New Year's Day to schedule appointments this morning, and when I learned that that had been scheduled as a day off, we obviously understand the huge healthcare workers are under, and many of the vaccines are delivered through community partners who normally would not operate on Christmas or New Year's. But our direction to AHS is to treat the administration of the vaccines as an emergency. Every day that we waste is ultimately going to represent lives lost, and we should be using every available working hour to administer vaccines. So I understand they took more time off in Ontario. That I understand that they simply didn't book vaccines on Christmas Day here because it was very difficult to get staff. But I hope that we will be working as close to around the clock as possible. I can tell you that in our cabinet conversation this morning, one of our ministers referenced a model of Israel, which apparently has the most efficient vaccine administration program in the world, and they are literally scheduling vaccinations 24/7. I'm not sure that we'll be able to get to that given the community partners that we depend on, but we have certainly conveyed a sense of urgency. This is obviously a case of, as Dr. McDougall just said, all hands on deck, and we should be using every day, 7 days a week, to administer as many vaccines as possible. That's the message that we sent today.
That concludes today's Q&A. Happy New Year, everyone.
Yes, Happy New Year. I'm not sure if I'm doing one of these again this week, but Happy New Year to everyone. And it will be, we still got some tough times to go through in 2021, but it will be a much better year. Thank you.